please use the chat, and we'll know that's an issue. All right, so I have this slide up here, Steps in Program Evaluation, and we can see that the first step talks about engaging stakeholders. And I remember when I was in school and I was learning about evaluation that I always thought this was kind of soft science, and I was more interested in like survey design and analysis. And then when I started doing work in the field, I learned how important that engagement really is. And even from something really small, I remember I did a project for a domestic violence shelter, and engaging stakeholders for them was just having an informal meeting at their board, saying, what is it that you want to know? We're going to set up an evaluation. What's important for you? And that didn't take too long, and it wasn't too cumbersome, but it was a way to make sure that that information was going to be meaningful for multiple participants. The rest of the things we'll be going through and we'll be able to see. Okay. Oops. ¿Qué pasó, mi amor? So the next question that I have is, what is program evaluation? And this definition comes from the CDC. It's a systematic investigation of the merit, worth, or significance of a program. Should I use the arrow keys to move between them? Okay. And I was trying to think, what does that really look like for people? And the first image that I came up with was this. The idea that, sometimes talking about numbers and analysis can be really confusing. It can look like some of this math, and it can leave us maybe unsure or perplexed or of what's going on. So I know that we're all at different levels, and I know that we talked about it, but the two ways that we classify as a science evaluation, I've depicted in two cartoons. So there's this person sitting on the boat, and it says, review the monitoring data. Why bother? We're going fine. You can see the project going off the cliff. So this first question is, are we doing what we planned? Are we doing what we said we were going to do? Or are we maybe going a different direction? And then secondly, we have this commercial, or this cartoon that says, I taught Stripe how to whistle. I don't hear any whistling. It says, I said I taught him. I didn't say he learned it. And this kind of brings up the what results are we getting, and more importantly, are we getting the results that we want? As depicted here, you can see teaching doesn't necessarily translate to someone learning. So here are the fancy words for them, this two-pronged approach. Process evaluation is that first cartoon, that first question, are we doing what we planned? Assessing the extent to which a program and everything in it is implemented as intended. So if I say that I'm going to have 10 sessions of a curriculum and I have 8, it's documenting that happened. Or if I say I'm going to have 10 and it took me 15 to complete the material, it's documenting that. And then that second cartoon is that outcome evaluation of what results are we getting. And so that's the terminology we use there, assessing the extent to which this program produces the intended change. So what are we looking for in changes? We're looking for changes in knowledge, skills, in prevention work. Frequently, are people picking up bystander, intervention skills, this kind of framework. So why is it important to do both? Normally when we think about evaluation, I think the outcomes, we want to know if we were effective at meeting our outcomes. And I saw this as an example. I've got the citation on the bottom. There was a workshop in Washington, D.C. Of an example in Jamaica, and I think it's just a great example. There's this program called Incredible Years. Some of you may have heard of it. It's an early childhood mental health, disruptive behavior intervention that typically requires 15 group sessions. So it's, considered evidence-based in the U.S., great outcomes, and they decided to replicate it in Jamaica. So let's check out their outcomes. And I know it's a graph, but I'll walk you through it. So it says changes in classroom ratings in intervened and control classrooms. So if you look at the red boxes, those were these kids and these parents who went through this parenting mental health intervention. And it looks like we got some really great outcomes. The little blue dots show that significant. So, we see increases in appropriate behavior, interest, being able to help others. And, for some of the control groups, they're actually going the opposite way. teacher warmth makes sense. If you're dealing with more difficult, you know, adults and kids, it might be harder and you might feel less warmth. So if we just looked at the outcome evaluation, this is all we would see. So what about the process? The person who presented this talked about challenges that they had in Jamaica. So participation was a really big barrier. You know, it was not a safe neighborhood. People didn't have you know, finances to pay transportation. So check out the responses. You know, they talked about their encouragement system where they were like calling people all the time and checking in with them. They hired security because that was a barrier. They were, you know, providing transportation. And then there were also all of these other things where some of the materials in the U.S. were just not suited for a Jamaican population. You know, maybe there's an example of like, you're cooking your kid mac and cheese. Well, you know, that might not be happening over there. So they had to create new materials. They had to adapt these things for their environment. I know they talked about how electricity was a really big barrier, and they had to have everything that was video, like a backup plan in case that went out. So this is their kind of their process evaluation. These are kind of the things they did in response. And I think this example really demonstrates how important that is, because if they were to take this program and say, wow, it worked really well in this one part of Jamaica, let's go set it up in this other city, without any of these, you know, process evaluation outcomes, would they get the same results? You know, and then they might think, wow, this intervention really doesn't work. So I think that's just a nice example talking about why process and outcome are both important to measure. So why do we go about doing this? We kind of touched on the first few things up there about, you know, comparing actual results to intended ones. I like the third big bullet. Why does this program work, or why not? You know, I think that first quote really demonstrated that knowing one way or another is really important for us moving forward. It helps us to inform that programming, planning, and improvement. You know, I think the big catch-22 is funding. We really want to provide great services, but wow, if we can, you know, apply for grants and we can show how great our services are, like, that's really fantastic. And I think that's personally why I really like evaluation work, because I feel like DVSA programs, other folks are doing such great work, and if they can document that, you know, hopefully we can continue to get them the funding to keep that going and make it go even further, which fits into that sustainability outcome on the end. So this came from a School of Social Work from UW-Madison presentation that was specific for child welfare, and I think that it's got some overlap for our fields as well. I think we can all relate to that first one. Social service funds and client worker time and energy are limited, so we've only got so much time. So we want to use our time, we want to use our money, and allocate those resources the best that we can. And you know, realistically, in our field, you know, especially in prevention and some advocacy work, a lot of these things have not been evaluated. You know, we're doing all these things, we're doing really great work, and in that same conference, this was another speaker that came from Michigan State, and I put a red box around it, and this is specifically intimate partner violence, but they said our evidence base is pretty weak. You know, there are not that many interventions that have done research, and there's not that much evidence meeting a gold standard. Now, that doesn't mean that we're not doing really great work, but the documentation isn't necessarily out there. So the more that individually we can evaluate our work and share that with the community at large, the more we can learn from each other and continue to create really great programs, really great prevention, and really great services for victims and survivors. So how do we set up something with evaluation? I spent so much time thinking about this when I was setting this webinar up, because there are so many steps to this process, and you could have a class on all of them. And so this is just an introduction, so we'll just kind of graze. But you know, if you have questions, please feel free to come up and ask. We had a nice quote from Yogi here that says, "If you don't know where you're going, how are you going to know when you get there?" And I think that leads very nicely into a tool that can be really useful or can sit on a shelf depending on how it's used, and that is the creation of a logic model. A logic model is a picture of how your organization does its work. It's showing why you think it's going to work, and it's linking the outcomes you want to see with the actual activities and inputs that you're putting in. So if you're more of a visual learner, this might help depict things a little bit more efficiently. So we have these resources, we have this input in that green bubble. So that would be things like, staff time, a curriculum, the technology you need, activities. This might be, a lot of us are doing work in schools, so, presentations in schools, web-based media campaigns, whatever that activity is. So that's your planned work, and then your intended results on the other side. And we'll go through the difference between outputs, outcomes, and impacts. Peter, do we have that poll question? So I have a quick question for you. And it is, have you ever created a logic model? Because that'll help me determine how much time I should spend talking about this. So hopefully there will be something popping up on your screen. Yeah? All right. And Peter will let me know when we have answers. I'll give you about 10 seconds. Okay, I don't see it. All right, great. So we got those responses. Thank you so much. So it says 47% of people say that, yes, they've done this. 41% say no, and 12% are not sure. So thank you so much for answering that. I'm just going to show well, before we go on with that, those of you who have completed a logic model, can you share one of those experiences, maybe unmute yourself, share an experience of what that's like, any difficulty you might have had, what you learned, suggestions you might have for someone, and then we'll talk more about it from there. Okay, okay. Was someone sharing? All right. I think we've got a lot of feedback on the call. So maybe if you have something you could share, maybe you could type that into the chat category, and we could look at it from there. And I'll give you about maybe 1 minute if there's any tips that you have from creating these that you might want to share. No more participation after this. All right. Well, I see that there's not much shared, but if you think of something, please feel free to do that, because I know that we've got a lot of expertise on the call, and due to some technology, it's kind of difficult, but we want to share that as much as possible. Oh, please go ahead. So here's an example of a logic model that I did actually in Excel. I took a screenshot so you could see it. And you can see those highlighted yellow categories are the categories that we saw in that linear diagonal depiction. So we have our inputs on one side. We have them broken down into human inputs, organizational, and materials. This is a pretty detailed logic model. Then we have activities. We had some research that we were going to do before this project. Juntas Podemos. It was an obesity intervention program, a promotora training, which was a training for lay health workers, and different components. Our output, so what we were going to see as a result of that. Our outcomes, we wanted to see a decreased BMI, increased healthy eating, and the overall impacts that we were hoping to have, which, a reduction in obesity, improved health. You can see that this is a draft. There's a question mark. So this is one thing, what one might look like. here's actually a logic model from RPE. And when I looked at this, this was my reaction. Because although I have created logic models like this, and I definitely do, and they can be very useful, I think that if I were to talk to people about how this can be a really great tool to help you start off your evaluation and then show this, that might look a little intimidating. So what I think, to let you know that that level of detail definitely can help and it can be useful for certain programs, but that level of detail is not necessarily needed. I have this number up for you, 4 minutes, 41 seconds, and 0.28, I don't know, quarters of a second or whatever that is. And what this time is it's the amount of time that it took me to draw up a logic model for this webinar that I did. So if I was going to create a logic model for why I was doing this webinar, and I don't think that under 5 minutes is that much time, and I also think that a lot of that time is because I'm not very tech savvy and I had to put the cursor in the right place. So let's walk through it. Left category, we've got our inputs. In order to do this webinar today, I needed a computer, microphone, we got that working, so awesome. Webcam, didn't actually end up using that today. Staff, so that'd be me, my coworkers, and all of you. So what are we doing? What are the activities? Well, if we think back, we sent some reminder emails. I had to develop that webinar, and now we're holding it. That's pretty much it for this webinar. What are our immediate outputs? So what am I going to get immediately after I finish this webinar? We'll have an attendance log from our webinar that shows who was on, and I'll have the answer to that one poll that you asked. So I think those will be like the immediate outputs that I'll be able to hold in my hand. So what are the outcomes for this? We want to increase evaluation capacity of participants. That's like the main reason that we're putting on this introduction webinar. And what's the long-term impact of that? We want to improve programs. I mean, I think that's really what evaluation is about. We could put other impacts, like maybe we want to increase funding and that kind of thing. So, I don't know. I mean, that looks a lot easier, right? I think that maybe is something that we could sit down and do in 5 minutes for some of the work that we're doing. And to also demonstrate that, here, goal. A lot of people will put a goal on the top of their logic model. Frequently, it might be a mix of their outcomes and impact, or it could be something different. So here I'd say the goal of this webinar is to improve programs by increasing their evaluation capacity. This is a logic model that's created by a 9 and 11-year-old. Which I think is really cool. It's talking about safe place for kids. So they had, in their community, they were going to have these activities, a carnival, a car wash. They were going to try to raise money for playground equipment to have a safe place for kids. So hopefully we're sitting here thinking like, okay, maybe this is something we could do. But the more important question that hopefully you're asking me is, what does mapping out these activities, how does that relate to evaluation? And what I do when I am going into a project and evaluating them is a lot of times I pull the goals and objectives and evaluation questions from that logic model. Now, I own the fact that it is more common for programs that they're already in existence that they're going to sit down and write their goals and objectives first, and then they might make a logic model. So I recognize that that is the more common reality, but in my perfect universe, I'm setting up that logic model first. So we're going to talk about those sort of things. But the main reason that I think the logic model is useful is that it helps us sort into process and outcome evaluation. You can go back to each category and say, if this was one of our goals, how are we going to evaluate it? And so we're going to do that. So if I was going to create process evaluation objectives and questions from that logic model for this webinar, I'd go back to our activities. So our first activity was reminder emails. So my objective might be something really simple like send reminder emails. My evaluation question after that would be, were reminder emails sent? And I would ask people to describe that. Because, I mean, yes, no might be useful, but it might be more important to say, oh, we said we were going to do it 2 weeks before, but then I went for a coffee date, and then, something happened, I was on vacation, so really it was 2 days before. Maybe that impacts your participation. Develop webinars, our second activity. So here I put a little bit more detail. by today's date, WCASA staff develops a webinar. What's the evaluation question off of that objective? Was the webinar developed? Please describe. Yes, it was developed on my vacation. You can see that by some of the examples that will come up. And then lastly, hold webinar. So on 3/11/13, hold webinar with 80% of ELC participants and additional 10 prevention workers in Wisconsin. So if you see, this looks a little bit different than those previous objectives. And when I wrote them in different levels. And the last level is what we call a SMART objective. So it's specific, it's measurable, it's attainable, it's realistic, and it's timely. And if you look at it, you can see that there's a time. I'm saying that of these participants, we want 80. I want 10 other folks in Wisconsin. Now, how did I come up with those numbers? There was not any science behind that other than those would be my goals. Like my goal and my staff, if we'll assume that we all came up with that together and I wasn't on vacation, was that we would have that kind of outcome. And I think that sometimes we're really hesitant to set those goals for ourselves because of that initial quote of those 700 failures. Because we don't want to fail. We don't want to not meet our goals. But by putting those numbers and making it more specific, we're creating something that we're going to reach for more fully. Oh, there's the question. So the three different levels that you can see, again, there's no right or wrong answer. It's what is going to work best for you and your program. Is that level of specificity needed, or is that just going to stress everyone out and make it redundant? If so, send reminder emails might work really well for your program. So then if we look at the outcomes for like the outcome evaluation, this increase of capacity improve programs, how would we create those objectives and questions off of this? So I would use the same format as I just did with the process evaluation stuff, but this is going to be a lot more complicated because what does it mean to increase capacity? What does it mean to improve programs? What does that look like? So you could say as your objective, increase evaluation capacity of participants, but what's your question off of that? What does that really mean? It means that for something like this, we're going to have to break that down, and we're going to have to look at things like knowledge, motivation, engagement, desire to learn. So you can see here is an example of a knowledge objective. I might say that one of the things that makes up increase in capacity is an increase in knowledge. It might also be an increase in desire to do evaluation. But we'll just say we're looking at knowledge. So I created a SMART objective off of this. I said by the end of this webinar, 65% of participants who are participating will take this post-evaluation survey and they'll demonstrate an 80% or higher score on a test asking about basic evaluation. Don't worry, hypothetical, there is no test. But this might be something that I'm doing, and it's specific. Maybe, again, this is like way too specific for what you're doing in your program, but know that that level of detail is possible. And you can also make your process objectives really specific. If you remember that first logic model I showed you, that obesity prevention, this was a process objective that we had, which I think a lot of us in our prevention work, we've got to get people there. A lot of the stuff we need participation so we can relate to this. So, by this date, that was going to be in this year. Clearly, I'm not working on this project. 30 mothers, which was 7% of this one school of their total, which was 420, will be recruited to participate in this support group that we call Apoyémonos. Let's support each other. So that's what a more specific process objective. Just to show you two other examples, another knowledge one that came from that same intervention talking about increasing knowledge by 60 to 78% on this test, and then a behavior objective. Behavior objectives in prevention work, normally we're not at that level where we're like, as a result of our intervention, people are less likely to be sexually assaulted or they're less likely to perpetrate domestic violence. But here's an example of trying to increase someone's walking participation. All right, so if we got our logic model and we've got our objectives and we've got, these process and these outcome, how do we actually make this happen? And that takes us back to how are we going to measure those things? You know, we kind of talked about those outcome evaluations, and some of it's really straightforward. If we want to get people there and we're measuring attendance, we're going to look at the attendance sheet. That's pretty straightforward. And I think a lot of us are familiar with individual surveys, like, please fill out this survey monkey about yada yada yada. And there's some group surveys. Anyone who is in our evaluation learning capacity has to fill out this local capacity assessment, which is kind of done in a group. Or it can be like a group interview style. People sometimes evaluate things by looking at records, public data. Maybe, we're looking at the number of, there's a YRBS, a youth risk behavioral survey that is done by county, I believe, here in Wisconsin. And so we might look at, kids' self-esteem and say we're going to look at these public records every 5 years, and we're hoping that we're going to see an impact in their self-esteem because of some programming that we're doing. Interviews, focus groups, and frequently a combination of a lot of these things. So I'm going to talk a little bit more about surveys than anything else I've talked about yet, because I think that this is the thing that we're doing the most. Most of us who are doing evaluation work are doing some kind of a survey. Typically, it's at the end of some kind of presentation, and it's something like, tell us what you learned. It might have a question like, what percentage of students experience sexual assault, and we'll ask them to circle one of the answers. But there are some different kind of ways of doing this, so I wrote them down. A pre-post is if you have something typically that you're doing that's more than one session, maybe you have 10 sessions, you'll do a survey in the beginning and the end. So very similar to that, and you can review those results. The we'll go back. The retrospective pre and post is asking someone at the end of a presentation, how did you feel about something before and how do you feel about it now? We'll see an example of that. You can do a control group for comparison's sake. I know that in my previous position we had a program that was doing that, where they were doing a survey for kids that never participated in their prevention programs, and then they were comparing them. Or you can use standardized measures. So I've got this cartoon up. It says, excuse me, on a scale from 1 to 5, with 1 being always and 5 being never, how often do you answer random questions from people on the street? And so when we're developing surveys, one, the way we ask a question is important. You can see they're using a scale here. But what is 2 through 4? 1 is always, 5 is never. What does that mean to me if I'm answering this? And 2, sometimes we get really happy when we start doing evaluation. We're like, oh, I really want to know about this, and I really want to know about that. But we want to value people's time. We want to recognize what we can commit to in terms of analysis and really ask what we need. And maybe this kind of question might not be something that's needed. Here's an example of a survey that I did for a student-teacher sexual misconduct prevention program that I was a part of. And I would probably do it differently now, but the reason I bring this up is because the other thing with surveys is distribution. When are you going to distribute them? If you're doing a classroom program, are you going to do it at the end, the beginning? If you're doing something in the community, how much time do you need? And this is an example of something that maybe didn't go so well for me. I had someone who's like, you should make it, into a survey link. But really, who takes a survey online after an in-person presentation and will go on and respond to it? I can give you the answer to that. Not very many people. So in this case, it would have been a lot more efficient for me to print this out and distribute it to people. And I learned that lesson. So distribution is important, not just construct. Here's an example, it's kind of fuzzy, of that pre-test, post-test design. So you can see number 12, it says, my understanding of the subject. Maybe it's bystander intervention. So prior to attending this session, which category, and after attending it. So that's kind of a way to say, I think that this is a really useful thing when you're going in and you might know that participants that are all different levels. So there's some folks who really know about this stuff, and there's some who've never heard about it. And you can really look at that change by asking it in this format. So what is a construct? We'll get to why in a second. A construct is one of those things that maybe we're not sure exactly how to ask. like attendance is something that's really straightforward, but a construct, traditional gender roles, community accountability, unhealthy family relationships. These are all things that the CDC has listed as risk or protective factors for either sexual assault or intimate partner violence. And some of them seem really straightforward, like previous abuse. Like, you could probably just ask someone, like, have you previously experienced abuse? But as all of us know in our field, not everyone's going to relate to that language. And what does that mean by abuse? Are we talking about physical? Are we talking about sexual? So this can get really complicated really quickly. What does economic stress mean? I mean, you can't just ask someone, are you low income? Because that might not have anything to do with how they feel stressed about it. Someone might have all the money in the world and feel lots of economic stress. So measuring these constructs is a frequent struggle in the work that we're doing, which can make our evaluation really difficult. So here's the example of like why this is difficult. Question: do you subscribe to rigid gender roles for man to abide by? Please circle one. Yes or no? So we can already picture what kind of feedback we're going to get from a question like this. And this is where I bring up standardized measures. I don't think that we use standardized measures as much as we can. A standardized measure is something that a researcher has developed to measure some of these hard constructs, and there are a lot of them. And some of them, like this one, is only 8 items. And I'm not going to show you all of them because there's some copyright issues. But I've got some examples. So there's some kind of scale, agree to disagree, or maybe 1 to 7. And they're asking things like, please rate your agreement to, it is essential for a guy to get respect from others. A man always deserves the respect of his wife and children. I admire a guy who is totally sure of himself. Guy will lose respect if he talks about his problems. So you can see how instead of just asking someone like we did on the left, like, do you subscribe to gender roles, we're actually breaking those down and we're going through them one by one. And the other really nice thing about these standardized measures is that someone else has done the work. There's an opportunity for comparison because they've already happened. So we could say like, oh, compared to Dane County, what does it look like to the rest of this population that was in a research study? Are we above the curve? Are we below? And it's really good science. So there are 2 terms, reliability and validity, that we talk about in survey design. And reliability is how likely we are to get the same answer across the board. So if I ask group X and I ask group Y the same kind of questions, assuming that they're similar populations, are we going to get similar results? And validity is, are we really measuring what we're looking at? So we want to measure, male gender roles. Was that really what that was getting at? And there's some science about how they do that, but they go through it with these constructs. So what's the disadvantage? Accessing these things can be really challenging, especially for a typical program that's got lots of work, they've got lots of things on their shoulders, they're wearing lots of hats. Sometimes they cost money, sometimes they don't. That's definitely a barrier. Sometimes the length is really long. It's like we did a PTSD scale at one of my previous positions, and it was like 64 items that someone had to rank, and that's kind of long. And then most importantly, copyright. So we can't just take these things off, mass produce them, and use them how we want. We have to get permission from authors. But the really cool thing is I work here, so if this is something that you're interested in, I would be willing to try to hunt this down and try to work with programs. So if you're hearing this and you're like, wow, maybe this is something that could be for my program, please access, please contact Wicasa, and hopefully we can figure that out. So here's some examples in violence prevention of standardized measures. There's a rate myth acceptance scale. You can see how long they are. Acceptance of interpersonal violence, modern sexism, some knowledge and attitudes, bystander stuff, perceived control. So these might be some things that, in our communities, we're trying to impact by our prevention programming. It might be some items that either we could use or adapt to fit our populations. One other thing that I want to give is evaluation, because a lot of times those, do a survey, do an interview, do a focus group might not be what's really best for us in our program. And when I was when I was abroad in the Caribbean, we were evaluating a dengue prevention project. Dengue is a disease transmitted by mosquitoes. And the way that the intervention ended up working is that we sort of just went house to house talking to people. I'm under the hutch somewhere. I think I'm in jeans, but everyone's in jeans. And we just kind of talked to people about, what do you know? And then whatever they didn't know, we kind of filled in the blank. And this was the best form of intervention that we had based off of the situation we were in. And we're like, well, how are we going to evaluate this? We're doing this in Spanish. It's in a different language. We're not going to ask people to fill out a survey. This is not what this is. It's going to totally this is based on relationships and individual door knocking. So what we ended up doing is we created a different evaluation system that worked really well for us, where based off of a conversation, we gave participants a scale on a 1 to 5 of what their knowledge is. So one, I'm trying to see if I remember, one was like, had they ever heard of this disease? Do they know what it is? They got a 2 if they knew that it was transmitted by mosquitoes. And then their level would go up based off of what they knew about prevention, primary prevention, like not leaving distilled water out, and secondary, like, oh, when should you actually go and seek treatment? So here's the results. We did this in a bunch of communities, but this is just one community. On that scale of 1 to 5, you can see that we broke it up. No one had higher than like a 3.5. But we've got this key on the right, and I apologize, I didn't translate it. But based off of talking to people, we kind of judge. Like, are you young? Are you, a young adult? Are you maybe middle-aged? Are you older? Male, female? So we never asked people this, but we kind of judged. Again, is this really great science? No, but this was what was going to work well for our program. And what did we figure out? We figured out that men are at a higher capacity than women, maybe not so high. And we also figured out that the adult age, which for us was kind of like, someone 18 to maybe mid-30s, 40, was at the lowest level, which made sense because they were the ones out working in a lot of the sugarcane fields, and they were the ones that maybe didn't have as much education. And this was how many people? I don't know. You can see, however, if you added up the men and the women on the top of there. So it's not a huge sample size, but we replicated this in multiple communities, and we found the same trends over and over again. So this was really great program evaluation for us because what we learned is we've really got to do something to target that adult population. And if we're going to continue to do this work, we need to figure out how to reach them because they're not at home. So reaching them was hard, and we've got to figure out what that means. So again, maybe something a little unconventional, but it worked well for our program. Data management. These are like a bunch of drafts of surveys that I did. I think there were like 12 drafts, and I spread them all out and took a picture because I was like, survey drafts. But data management, I think, is one of the biggest challenges. We can get excited about creating our logic models and our objectives and our questions and going out into the community and distributing things. And I think it's really, really common for programs then to take them results and they sit on the shelf. So figuring out how you're going to manage data, are you going to enter it into a database? And, this is a whole other topic that I'm not going to go into that much detail about. But how are you going to go through this, and how are you going to make that happen? And the step further of once you have data collected, how are you going to analyze it? When are you going to do it? We call this an evaluation plan. And probably one of the most important components of going through this is committing to doing that, setting deadlines. We kind of talked about those SMART objectives that they had that day and they were specific. And, doing something like that with your evaluation plan is really uncommon, but can really assist people in moving forward. So talking about how do we own evaluation as our own? This is a nice little diagram that came from an RPE grantee meeting in 2012 that I think is nice because it's talking about continuous improvement and this idea that evaluation is not a static thing. It's not a one-time survey. So what do we do in it, going down that cycle? How do we do it? How are we doing? And then, why are we doing well or poorly? You know, kind of like that example that I gave of dengue fever. Like, why was that adult category lower than the rest? Like, why were women lower than the rest? And a lot of times, you know, depending on how your evaluation is set up, you might get some of those answers and sometimes you might not. You know, so you're going to extrapolate. You're going to talk to community members. Maybe you're going to pull some folks in who you did get to do some evaluation and say, well, what do you think is going on? And, you know, try new things to figure that out. There. Whoops. I like this cartoon. Doctor talking to the person on the scale. Yes, it's remotely possible that Earth's gravity has increased, but I think there's a much simpler explanation. And I think that evaluation is kind of like this. Why are we doing well or poorly? Is it really because gravity's Earth has shifted? Normally there's only if we're doing well, we know it's working, so that's great. If we're doing poorly, there's typically two reasons. One, the program doesn't work. You know, we thought that if we went in and we did 10 sessions with this group of kids that we would increase their capacity to be bystanders. You know, maybe that's just not the case. Like something about our content, maybe, you know, it's not long enough. Maybe we can look at those principles of prevention that maybe we're not addressing things enough to make this happen. And also commonly, but not as often thought of, is maybe our evaluation isn't really measuring what we are doing and what we're looking at. So, you know, we're trying to see if they're increasing bystander intervention, but what we're asking them isn't valid. It's not really getting at bystander intervention. And I think this comes up a lot. And this second point is why taking the time to write that logic model, taking the time to put out those questions and objectives and outcomes is so important. Because you really want to make sure that your evaluation links to your program. Because if it's not, you know, if it says you're working well, I mean, who knows what that means? Because it's not going to be your program if that's not really what it's getting at. And if it's not working, we want to know why. If we're going to take the time to do this, because it can be time consuming, we want to make sure that the evaluation is set up really well. I'm going to go back to this cartoon because I left out the bottom part. I put a white bar over it. So it's, you know, this guy going off the cliff like, oh, we're fine. Don't worry about it. And then on the bottom it says, remember, monitoring and evaluation information is useful only if it's used. So we can collect data all we want. We can do all this evaluation. But if we don't take the next step to really use that to change programs or inform results, you know, how is that really getting at that end goal of program improvement? You know, it's probably realistically not going to get there. And I was hoping, I know that our audio is kind of bad, to ask folks to talk about, you know, some examples that they have of information that they've used in evaluation and how they've used it and how that's been useful. So I'm going to check in. Peter, do you think we have the capacity to do that? Yeah, or maybe you can type it in. And I know that in order for people, oh no, I touched the mouse. In order for people to apply for the evaluation learning capacity, this is one of the questions that was asked was, you know, how have you used data to inform changes? So yeah, maybe if you have something that you can share, you know, your information is really valuable. We can learn a lot. If you could put that in your chat box and say, hey, you know, we were collecting information on this, and as a result, we changed this, and you know, maybe it worked really well, and maybe it didn't really work well. But I'm going to give you a minute to do that. And then I think we've only got 1 or 2 slides left. So again, if you have anything that you think is useful. Oh, okay. Do we see anything? Again, if you have anything that you think is useful in terms of using data to inform changes, and someone put in here, we created surveys 3 years ago after presentations on internet safety. The data indicated that there were other areas people needed information about, sexting, cyberbullying, so program was revamped to reflect that feedback. That sounds great. Thank you so much for sharing that, Josh. And then up here, typical question. If a child disclosed sexual abuse to me, I would report it. Well, everyone will say yes to that, but we know that sexual violence is the most underreported crime. So useless as a survey question? That's a really great question, and I think that that might be an example of a construct measuring, reporting. And so kind of like, are you sexist? Yes or no. Are you going to report something? Yes or no. We know what the answer is going to be. So maybe it's something like giving a scenario and asking people in an open-ended question, like what would you do? Okay, so you're a teacher in a school and you see that a student is frequently alone with another adult, and maybe that they're acting a little bit more antisocial, and one other concern. What would you do? So that way you're kind of like leaving it up. That might be one approach. Maybe there has been some kind of standardized measure talking about reporting of, child sexual abuse that we could look at and disclose. All right. Well, if you think of anything else, please feel free to go in and put that in there. Can we leave this up that I can see that? And can I? Okay, awesome. So the last thing I'm going to go through are some evaluation principles that came from, where did these come from? I have a citation on my other screen, so I could give them to you. I believe they came from UW Extension. Says we believe evaluation is most effective when you're linking program planning and delivery. So that's what we were just talking about. Making sure that your evaluation questions are really linked to the activities you're doing. You're involving the participation of stakeholders. Those affected by the results, have a right to be involved. And, if we are doing advocacy work and we are working with victims and survivors, getting their participation can be really useful because sometimes they can help us wordsmith, figure out what ways of asking a question might yield the best results. And if we're going to get stakeholders to be involved in our evaluation, they're going to be more likely to, want to give us support and funding and engage because that information is going to be valuable to them as well. Support an organization's capacity to learn and reflect. Again, not an end in itself, kind of that cycle, how this is an ongoing process. Respect the community served by the program. I think this is really big. I remember I was working for a program and we had an intake packet. It was a direct service program. And we had, starting at age 6, we were asking kids to go through an interview to fill out 12 pages of information. And they were like some really tough questions, like, have you ever seen your mom hit your dad? Have you ever seen your dad hit your mom, or your mom's partner hit your mom, or, whatever was appropriate in that scenario? And did you witness things? Did you hear it? Did you ever call the police? And 12 questions of this for a 6-year-old, in my opinion, was not respecting that community. And so we were talking about, well, how can we meet funders' requests, get the information we need, but also be, respectful of the participants that we're evaluating. So I think that thinking about that and figuring out what that means for your program is another great reason that engaging with stakeholders is important. And lastly, enables the collection of the most information with the least effort. You can't and don't need to know everything, kind of that question of being asked random questions on the street by surveys. Is that a critical question? Focus on what you need to know and what's important for you and stakeholders. So I've got some links up here that came from in RPE training on evaluation. There's some really great stuff on that last page from UW Extension. if you're looking for more information, please feel free to contact CASA for that. And I guess we'll open it up for questions. So if there's any questions or any comments that you'd like to share, please feel free to do that now. Are they able to talk? Yeah, and if you want to type in a question, that works really well as it also. Do you have any questions? Yeah, because I can talk, but. So again, you can unmute yourself if you'd like to ask a question, or just type that in. Okay, so there's a question that came up. It says, will there be an opportunity for the group to develop some standardized type testing or address the issue of maybe children using school computer time to survey? So I'm guessing that refers to our evaluation learning collaborative, and we can talk more about what it's going to look like moving forward. Today is my first day actually working at Wicasa, so I'll know the answer to some of that stuff hopefully by the end of this week. But I think that talking about the science and what it takes to make a measure a standardized measure can get kind of tricky with some of the information, but again, we can always use that process to figure out how researchy do you want to be versus what's going to work for your program. So standardizing in your program might be looking at something and saying like, oh, this is, we're getting the same kind of results in these different schools with the same intervention. So maybe we think that this is pretty reliable, and that we've continually gotten those results. And in terms of validity, maybe we, do some one-on-one interviews with people who fill things out and ask like, oh, are their interviews matching up with the questions that how they responded on the questionnaire? And if not, maybe we've got to tweak those questions to make sure it's valid. So in terms of making it standardized, I don't think that's something that we have the capacity to do, but we could talk about, getting closer to that and possibly using other things. Using children time to do surveys on a computer, I think in a perfect world, that's super awesome. I think that's a case-by-case basis in the schools and their capacity to do that. But I know we'll be on future calls, and we're going to get any conversation issues worked up. So either if you wanted to unmute yourself to speak more further about towards that, please feel free to do so. Otherwise, that's something we could address as well. Will you be sharing this PowerPoint with us? You want my handiwork. Yes, I think we can definitely send that out. And someone's saying this has been great, so that's really wonderful feedback. Any other questions, comments? I know that finishing early is something no one likes to do. It says, it could also be helpful to look at other empirical studies and their measuring that closely fits what you were looking at, and or modifying that study may be helpful. Yeah, thank you for sharing that. That's definitely true. I think that there are a lot of things that have happened that closely resemble the work that we've done, and if we can not reinvent the wheel and we can pull from other lessons and challenges that people and successes have done, like that's fantastic. And there are other studies that we can look at, and if that's something that's useful to everyone on this call, in terms of framing future prevention calls, we can really try to make sure that we include those case studies. All right, and Okay, here's a question from Vicky. How do we access the surveys that you shared earlier, rate, myth, acceptance, bystander, etc.? That's a good question. I figured that someone would probably ask that. Those are all going to be case-by-case basis. So if you are invested in learning about one of them, what I would do is I would type the title into Google. I'd put like the quotes around it so that it has to come in like rate, myth, acceptance, and they can't break it up. And you'll see information on psychometrics, which is like their validity, reliability, but you should also find, clicking on some of those links, who the author is. So it might say like Jameson et al. And typically what has to happen is you have to figure out how to contact that author and, get permission from them. And I don't know if anyone is familiar with the conflict tactics scale, the CTS. It's a common scale maybe used to measure child witnessing violence and comparing it to parents' results. So we use this in a program that I was in. It's a standardized measure where we would ask people, we would sit down with, whatever victim was the adult, male or female, and say, has your partner ever hit you? Has your kid witnessed it? Has, your partner ever treated you poorly? Has your kid witnessed it? Has your partner ever spit on you, choked you? And then afterwards it was always asking, has your child witnessed this? And then we also asked all the kids in the program, have you ever witnessed this between your parents? Asking them all the same behaviors. And with that study, we gotten permission from the authors to use it. They were letting us use it for free. So like I said, a lot of the times that like authors are like, wow, cool, I'm a researcher and I put all the time to create this scale because I want people to use it. And this is really great that we're going to go out and use it. But we had to translate it because, 90% of our community was monolingual Spanish speaking. And in order to translate a measure, you have to get permission and copyright permission. So we had to contact the authors and they weren't getting back to us. And it was, so sometimes that is a big challenge, is that access issue. But if there's something specific that you're interested in, you can contact me. And I am starting here, so I don't know what my position will entail, but if getting evaluation copyright permission for programs is something that would be valuable and important to you, I think that's definitely something we could look into. But yeah, I would just start by Googling it. A lot of times you can like find in like Google Scholar, they'll have an abstract. Even if you can't get the article, or there's some articles that are free, and then they'll like be talking about this measure and what they did with it. And you can find one or two of the things about it. Like I was able to find the item number on all of them, and all of those just came from one research article. Yeah, and yeah. And my coworker is telling me if you Google rate, myth, acceptance scale, that one in particular, you'll find a lot of information on it. And some of them, like I know there's a survey called a ProQual, which is looking at like vicarious trauma in workers. Are you like burnt out? There's 3 different scales, and it's been like translated into like, I don't know, 40 different languages. It's used all over the place. It's got really great science, and that's just you can just download it off the internet and click it, and there's free access for that. So that hopefully that's the answer to that question there. Anything else? If you are replicating a study without modification, is copyright required? Yes. I always go on the side of you really want to, if you're using, scientifically standardized measures, you want to make sure that you're contacting the author. Because, we would never, ever, ever want someone to get sued for plagiarism. And, so I think that it's better to be on the safe side if you're not sure about permission than the alternative. And again, I think that would be really great if, as a coalition, this is something that we could, help you contact. Another thing that can be really useful for you is to go to your local colleges. If you have a community college, or if you have a university in your community, to talk with, to like figure out like who's doing work in this field, because they're going to be like the experts on copyright, on if you need IRB approval. That's like if you're doing a research study, you have to make sure that you're protecting your subjects, and they might have access to things. So that's another really great resource, is to do some Google, like, oh, who's doing this in our community? Send someone an email, say, hey, I'm interested in doing evaluation. You know, maybe is this something that you could help me with, or you could refer me to someone. And that's great too, because then you're building partnerships, which is awesome. All right. Any other questions or comments? Okay. Well, if that's the case, I just want to say thank you so much for taking the time to join us today. Gave me the opportunity to talk about one of my favorite subjects, which is awesome. I know that we really had some technical difficulties getting started, so thank you so much for being patient. I do not have my contact information up there, but if you Google Wicasa, you can find a general email account and you know, other contact information. So please feel free to come forward with anything. And thank you for the welcome comment. I appreciate that. I'm really excited to be here at Wicasa. So I hope you all have a great rest of your week.